Hello, my name is Simon, and I have a few questions to ask you. Do you know anyone that smokes marijuana? These are rhetorical, so you don't have to raise your hands or anything. Do you know anyone that smokes marijuana? Anyone that's, or if you smoke yourself? Nay, the same said about cigarettes. Alright, now, the bigger question is, which is more harmful for you? There's been a lot of information that's been given out whether cigarettes or marijuana are more harmful. The problem is knowing which information is correct and which information is up to date. Both cigarettes and marijuana have good and bad effects on the body, which is why it's sometimes rated which one's worse than the other. Alright. The main components that cause the effects in cigarettes are nicotine, and in marijuana it's a chemical called tetrahydrocannabinol, or commonly it's called THC. Some of the effects in nicotine, it's highly addictive, it increases blood pressure and heart rate, it causes you to breathe faster and less deeply, makes it harder to breathe. It constricts the artery, it suppresses appetite, enhances brain activity and concentration, and it improves cognition processing, and it improves memory. Some of the effects of THC are the distortion of perception, which is why it's so highly sought after. It gives you loss of coordination, it increases heart rate, anxiety, suppresses nausea, it relieves eye pressure, increases muscle spasms, stimulates appetite, stops convulsions, eliminates menstrual pains, and it's a bronchial dilator which clears the lungs of smoke, smog, and pollutants, and including cigarette smoke. Another factor that doctors and scientists think about when they're comparing which is more harmful, it's the tar they contain. And there's some major difference between the two. Cigarette tar, when it's digested through when it's in your body, it breaks down into two separate chemicals, which are lead-210 and polonium-210, which both of them are radioactive. And it's been proven that what causes cancer from cigarettes, it's the radioactivity from the lead and polonium that comes from the tar. Another thing is that the tar, it easily sticks to your lungs and the lesions in your lungs because of the glass that is found in the cigarettes. With marijuana, the study in the 1990s showed that cannabis leaves 1.5 times more carcinogenic than cigarettes, which it means that they have that much more tar. The problem is, when marijuana users smoke marijuana, they don't smoke the leaves, they smoke the buds, which only have 33% as much tar. And because it's a bronchial dilator, the effects are lessened because it opens up the lungs, so the tar has less of a chance to stick to them. There's a lot of other chemicals in marijuana and cigarettes. The thing though is the number of chemicals don't matter, because rat poison only has 50, yet it's lethal to rats and humans if you have enough of it. The cigarettes contain over 4,000 chemicals, 50 which are known carcinogens, which are harmful for you, and there's a lot of other ones that are harmful for you. But marijuana has over 40% of the chemicals, over 400 chemicals, and about 99% of them are purely for giving the plant its structure and functionality, not for the hallucinating effects or anything. How the amount of tar can hurt depends on how much you use it, and smokers that smoke cigarettes smoke a lot more than marijuana users. An average smoker will smoke about a pack a day, whereas heavy smokers will smoke anywhere from 1 to as much as 3 or more packs a day, which is a lot of tar and nicotine. But marijuana users, when they rarely smoke more than 1 blunt a day, or joint a day. Sometimes up to 2 or 3, but that's on a rare occasion because it's more expensive. Another thing that causes people to think that marijuana is more harmful than cigarettes, there's a lot of myths about it because of added information. One of them is that marijuana is a gateway drug, which means you try marijuana, then you want to try other drugs. The thing though is that's definitely false, because a survey in the 90s showed that the first drug most people try, it's not marijuana, it's nicotine and cigarettes. But not only that, but the US government-owned statistics shows that 75% of marijuana users never try harder drugs. So if you want to use the logic they use here that marijuana is a gateway drug, it means that alcohol should be a gateway drug because most people try alcohol before they even try cigarettes. Another myth is that marijuana causes cancer. There is a very, very slight chance that marijuana causes cancer. There's never been any proof that it does, which is funny because people refer to there's high potency marijuana, and people who smoke high potency, they're considered to have higher chance of having cancer. That's not true, because the higher potency means you have to smoke less to get that high feeling that you want. Which means you smoke less means you have less tar in your lungs, which means there's less of a chance of getting cancer. Another thing, if you bake marijuana, I'm sure you guys have heard of brownies, or even weed tea. Ingesting it like that, there are no health risks at all, because it's digested and then just going out through your digestive system. The risk from getting cancer from meat, salt, or dairy products is higher than marijuana. So that gives you an example. Learning impairment. There's a lot of people that say that you smoke marijuana, you will have some learning impairment, which makes it hard to learn. In 1996, the U.S. government claimed that heavy use might produce learning impairments. It's already doubtful, because there's not very many heavy marijuana users. Besides that, there's very few people that actually use marijuana on a daily basis. And when there are learning impairments after smoking marijuana, it's a very subtle effect, very minimal, and it's normally temporary, which means after anywhere from a couple days to a month, the effect will fade away and you're back to normal. The effects for casual users, ones that use it maybe once a week or maybe once a month or once every 6 months, there are no effects because it's in your bloodstream so little that it doesn't have a chance to affect you that strongly. Scientific surveys have shown that, or scientific experiments have shown that alcohol gives you more learning impairments than using marijuana does if you use it on a regular basis. One more thing that the government has to say is proof that marijuana is more harmful is emergency room admissions. Some of you have been to the emergency room. Have you ever gone to the emergency room and mentioned marijuana? Not even talking about maybe you broke a leg and you're talking about you heard marijuana on the TV. If marijuana is mentioned once in the medical report, it's automatically considered as a marijuana-related emergency. Even if you fell off your chair and twisted your ankle, it's a marijuana-related emergency just because the word marijuana is used in the report. Along with that, less than 0.2% of emergency room admissions are marijuana-related. Keeping in mind that most marijuana-related emergencies don't even have anything to do with marijuana, that kind of doesn't even matter. Now, if you look at all the facts, it's quite obvious that while there are negative effects to smoking marijuana, just like in cigarettes, smoking cigarettes is more harmful. But if senators could see the fact as clearly as I can, I could imagine that marijuana would be sold in stores and cigarettes would be illegal.
Hello. Hello, everyone.